We know that having a pet in the home can bring a lifetime of happiness, but does that happiness in turn translate to better health? Well, my guest today is someone who has spent her professional career researching just that. Not only is she a licensed veterinarian, but she's also a professor of molecular epidemiology at Uppsala University in Sweden, and quite frankly, one of the smartest guests that we have ever had here on the exam room. With that, we welcome Dr. Tove Fall to the show. Thank you so very much for being here, Dr. Fall.
Oh, thank you so much for the invitation.
It's so cool that you're here. Your research is so fascinating to me. What gave you the idea to start studying the connection between having a pet in the house and how healthy that person is?
Mm, well, it all started with me having my clients coming with their dogs and the cats to the clinic. And I mean, I could really tell how important the pets were to their owners, and especially, when they had a severe disease and we might have to put the dog down or so. You could really tell how much the pets meant to their owners. And also, they told me all their stories on how the dogs or the cats would also provide them with social support, and how the dogs will motivate them to physical activity and to meet other people out in the park. So that made me start to read up on, is there any science on how the pets affect us and our health? And of course, there was a lot of studies done with surveys interviewing owners who all said, the pets are so valuable to me. But looking at like more hard data and health data, that was not so easy to find. So there was only a couple of smaller studies. And when you do research, you usually need quite big numbers to actually be able to say something. And we also need to know a lot about the people who actually get the dog. Maybe they are different from the people who are not getting a dog, and they're healthier because of those reasons. So I was thinking, I really need to do something well-designed, large study. And then during my research, I started to learn about how to do register-based epidemiology. So that means that you could take different data sources. So in Sweden, for example, we register everyone who comes to the hospital. We all have just one health system. So those data are kept in a single national data register, and you can link that to other data, because we in Sweden we use the same personal identity number for all official administration. So when you get your school grades, or if you buy a dog, you will actually register that with your identity number. And that means that we can link this data and then study different questions about health. So that was kind of how I came up with this idea.
That's really interesting. And based off of your conversations that you were having with your clients, I'm assuming you had an expectation going in that there probably was a positive effect that having a dog or a cat in the house would have on that family's health, correct?
Yeah, I was thinking that mainly it would, be positive to have better social support and also do more physical activity. Here in Sweden, you really have to take your dog out for walks at least 3-4 times a day by law. But also, we know that if you lose a family member, like if you lose your spouse or your child, then you can have an acute stress that will can make cause, for example, acute cardiac event the coming months after a severe loss. So I was also thinking that maybe some things related to keeping a pet might also cause some negative stress.
So I want to back that up and say by law, you have to walk your dog 3-4 times a day, isn't it? I think one of the things I read in your presentation that you'll be giving at the International Conference on Nutrition and Medicine is by law, it's every 6 hours. Is that correct?
Yeah, so you can't leave the dog alone for more than 6 hours. Wow. But you have to also provide the exercise it needs. If you have a big dog, for example, they require some more exercise. So it's quite tough to keep a dog in Sweden. And it's also cold climate, so it's not so easy to keep them, outdoors in the garden. and you can't leave them alone for a long time. And in Sweden, if you're an adult, both parents work, or both adults in a household work. So it's quite expensive also to get a dog. So that's something that drives the dog ownership rate to be quite low. So it's quite low in Sweden, around 15%.
Yeah, that is much lower than here in the U.S. I'm thinking just on my street alone, over half the homes have a dog in them. So obviously, we don't have the laws that say that you have to get out there, 4 times a day to take the dog for a walk either. Even though a lot of people here do something to that effect. Why do you think it is that there are laws that say that you must take care of the animal in such a fine fashion? Like, what was the driving factor there?
Yeah, we have quite strict animal protections laws in Sweden. So one of our most famous authors, Astrid Lindgren, so she wrote children's books about Pippi Longstockings and other, they're quite famous, at least in Europe. She was really proactive for the animal rights movement. So she was one of the causes that you now have to have all dairy cattle. They have to go out in summertime, for example. So we have a lot of those debates in Sweden, and I have a quite strict animal welfare legislation.
So this research that you conducted, it focused, at least in part, on the cardiovascular disease risk and sudden death. Now, this was a study that I believe that you co-authored back in 2017. So for this particular study, what did you discover?
Yeah, so what we discovered, we followed people that were aged 40 or above and never had a cardiovascular event before in their lifetime. So we started off, that's called a cohort study. So you start off with a population and you have some of them then having a dog and others not having a dog. And then we follow them over 12 years. And we assess then in the group that had a dog and the group without the dog, what was the risk of different cardiovascular outcomes and what was the risk of death. So what we found was that overall dog owners were less likely to die during follow-up, even when accounting for differences in age and sex and other factors. And what we found was that the differences was most clear in the people that lived in single households. So there was, if you looked only within that group, the differences were huge. So you could see that the dogs might have a bigger effect if you live alone. And I think that is natural for some reasons. One is that if we look at the physical activity part, if you're a single dog owner, you have to do all that physical activity. You don't have anyone to split it up with. The other thing is that if you live alone, you might have a greater need of a social support and a friend. So you may benefit more from the dog. And looking at myself, when I had my first dog, I got her when I was 25 and I was a single, and I was really in a tight relationship with the dog. We did everything together, and I remember that if she got sick, even if it was just something minor, I would get extremely worried. And then I met my husband and we had kids, and suddenly the kids, of course, like they became the center of our household. And then if the dog, threw up or there was something minor, I would just be more relaxed, but she would also not be as important. It's a bit, sad in a way, but I do think that if you live alone with your dog, you might have a tighter relationship than living together with other people as well.
Yeah, companionship is definitely a big thing when it comes to having a pet in the home. Specific cardiovascular events here that you were looking at, I believe you looked at heart attacks and strokes and cardiovascular disease overall, as well as all-cause mortality. What did you find in terms of the likelihood of having a heart attack? Let's start there.
Yes, so then we have to look at the numbers. So let's see. So if you live in a single household, we could see that you were protected from having if you have a dog and you look at compared to others that do not have a dog in a single household, there was about 11% lower risk of a myocardial infarction. And the risk of dying from cardiovascular disease was even lower. So that was around 36% lower risk of dying in a cardiovascular event if you were in a single household. While if you live in a multiple person household, we didn't really see a big effect on getting a cardiovascular event, but we could still see that you were at lower risk of dying during follow-up compared to other non-dog owners in the multiple person household.
And how long was the follow-up for the study?
12 years.
That's a pretty long time.
Yeah. And then we also conducted a follow-up study looking at, okay, but let's say that you get a myocardial infarction or stroke. Is it so that the dog owners fare better? Because you could think about them, they might be in a little bit better shape. They might also get in earlier. That's what's seen for other people who are doing a lot of physical activity, that you notice symptoms a bit earlier if you are active. And we could actually see that even when adjusting for all other health conditions, if you get into the hospital with a stroke or myocardial infarction, you have a better outcome if you're a dog owner compared to a non-dog owner.
Just hypothesizing here, would you say it's more of the emotional support component here, or the fact that having a dog means you have to be physically active because you have to go out there and walk it?
I think that the social support is quite important. We know that being alone is a risk factor for dying early. And we know from other studies that if you have a dog, you connect with other people. And I can see that here in my area, that I have a dog and I know all the older people by name and their dogs. And I can see all the dog owners, the senior dog owners, they go together on walks and so on. So I do think that the kind of company side, the social support side is really important. But then, of course, physical activity is really important as well. So, and it's a good motivator. I actually met the doctor when I was talking about these studies, and he approached me coming from the audience after, and he just told me, that I'm sure my dog saved my life, because he was single and he was a medical doctor and he had an ischemic stroke and he was severely disabled. So he had problems getting out of his bed. So, of course, people started to talk about, well, maybe he can't keep his dog. And some people helped him to take care of the dog. But then he had this big goal, like, I will be able to take care of my dog myself. So he really got out of that bed. And the way he learned to walk again was from the motivation to get out and take care of his dog again. And I met him 6 months after his stroke, and I couldn't tell at all that he had a stroke. So he was convinced, because we know that rehab is really important after having a stroke. And for him, this dog was the motivation he needed.
Wow, that's pretty impressive. Would you say that it's the upper age bracket, people over a certain age, maybe over 50, that seem to benefit the most from having a dog?
Yeah, we can see it's a little bit hard to tell, but we can see that it seems to be more beneficial the older you get, this effect. I guess that if you're in a working age, you might get some of these, company and the physical activity anyway. Yeah, I think the older you get, the more important it might be. And then, of course, many people, they hesitate if they're a bit older because they don't want to get a puppy. They feel that, what if the dog survives me and so on. So I think we should really make sure to make it possible also for older people to keep a pet if they have kind of the skills and what is needed to keep the dog.
Were you able to look at the various breeds of dog and determine whether or not one was more beneficial in terms of human health?
Yeah, so we looked, there are more than 400 breeds, so it's hard to kind of look at every breed. But what we did was that we looked at different groups of breeds. And there we saw that the owners that had the best health was those that had different types of bird dogs, like retriever dogs and other breeds. We also saw a tendency to having larger dog was connected to better health. So that could, be some sign of either that you are more healthy from the beginning. So that's always the problem with this kind of studies, that we're always a bit worried that the dog owners are a little bit different already from the start. Might be, persons that already enjoy a lot of physical activity, get a larger dog. So it may have to do something with that. Or it might be that the larger dog, protects you more because it needs more physical activity.
My wife would probably want me to ask if you can recall where beagles fall in those rankings. Do you know that off the top of your head?
No, but I can email you after the show.
Okay, fair enough. She's just going to be curious. She's going to be, you didn't ask her about beagles? So,
Yeah.
okay, no problem. One of the other topics that you're going to be covering during your presentation is answering the question of whether dogs get the same diseases as humans do. And
Yes.
I know that there is a connection between diabetes and dogs if the person taking care of them themselves has diabetes. What did your research find here?
Yeah, that was actually, we're quite proud of that study. We published that now in December in the British Medical Journal. So we don't just have access to different ownership registries. So that's what I used for the studies I already discussed. We also have a large insurance company. So it's something like 70 to 80% of all Swedish dogs have health insurance. And there's one company that dominates the market, and they share their data with us for research. So that means that we can both follow the owner's health through the hospital registry and drug prescription registry, but we can also follow their pets to see which pets get diabetes. So the idea here was that we think that since cats and dogs and owners share the same environment, they live in the same, housing. They also share some physical activity patterns, at least the dogs. So if you have a dog that you walk very little, maybe you walk very little as well, and so on. And some even share some dietary habits with their pets. If they, eat a little bit too much, they might also be more prone to give their pets a little bit too much food. And there might be like external factors like stress from like noise. If you're living in a very stressful environment, that might stress both you and your pet. Like if you're in a divorce or some other issue, they might be stress for everyone, which then what I mean is that you might have shared lifestyle factors with your pet that could cause the same disease in you as in your pet. So this is what we did then, that we linked the insurance data for the pets together with the insurance data for the owners. And what we could see, the main results was that if you get a pet with a dog, specifically a dog with diabetes diagnosis, you're yourself at increased risk of getting the diagnosis of diabetes. So I think that's quite amazing that we could pick up that signal.
That is pretty interesting. I have somebody who I used to work with here at the Physicians Committee who was very much overweight, diabetic himself, also adopted a dog who was very much overweight. And I believe the dog may have also had diabetes. And both of them, just through changing their diet and exercising, were able to not only lose weight, but reverse their diabetes diagnosis. Did you see anything in your research that kind of showed as somebody themselves gets healthier, their pet does as well?
I didn't look at that, but I think that's a really interesting question, because especially if you try to, reshape your lifestyle and you have a dog, I'm sure that the dog may benefit as well from that lifestyle change. So that's a really interesting question. And what I mean with dog diabetes, I did my PhD on dog diabetes. So the interesting thing is that generally it has been thought about as more type 1 diabetes like disease because they usually need insulin and they don't have so good insulin production themselves. But when you look at it, it seems like there's a multitude of studies now showing that overweight is a risk factor for canine diabetes. But the problem is that when they have a trigger for losing their insulin production, it rarely comes back again. So I'm sure that if you have a pet with diabetes, it will benefit from losing weight if it's overweight, but it's not that common that they can go into remission.
And I'd be remiss myself if I didn't ask you if you were able to look at cats or any other animal in addition to dogs.
Yes, I mean, I love cats, so that's really, and it's a very common question. So we don't have a national cat register yet. There's been several proposals about that. So I can't use this methodology to study cats in the cat owner studies. But we did look at them in the shared risk for diabetes, and we didn't see any signal in cats, which was a bit surprising because we know that diabetes in cats is very much linked to overweight. But we were then discussing that it might be explained by differences in physical activity. I mean, the cat won't move even if you start to take long walks generally.
You know what? Your research is as interesting as I hoped it would be. And I gotta know what's next for you? What's coming down the line?
Yeah, so I mean, I'm not only doing pet ownership studies, I'm also doing some other non-pet related, but now I managed also to connect the both because I got the big research grant to explore the microbiome in a new study called SCOPIS. So it's almost 10,000 people. And we have then deep sequenced. So what you do, you sequence the DNA you can find in a stool sample. And by doing that, you can explore the bacteria. And we have now done that in a large number of people. And we also have a questionnaire going on what kind of pets they have and some habits around pets. So we might be able to do the biggest study on looking at relations with having a pet and whether that could affect your gut microbiota composition.
I know quite a few gastroenterologists who are going to become fascinated with that research as well. So that is something to very much look forward to as well. Also to look forward to the International Conference on Nutrition and Medicine. You will be speaking there. That's coming up July 15th through the 17th. And for exam room viewers, exam room listeners, right now there's a special promo code for $50 off the cost of registration when you register at pcrm.org/ICNM. Use the promo code EXAMROOM, one word. You will save that $50 off, and we put a link to that and the promo code in the show description. Dr. Tove Fall, you are just one in a million, and I would love to have you back to talk about your next round of research when you're ready.
I'll be happy to come back.
Thank you so much for your time today.
Okay, thank you.
If your health IQ is a couple of points higher than it was a few minutes ago, go ahead and like this video or subscribe to the YouTube channel. And to take it even higher, head over to Apple Podcast or wherever you get your favorite shows. Look for The Exam Room by the Physicians Committee. Hit the subscribe button there as well and help to make your world a healthier place.